Permitting deaf parents to select for fetal characteristics of deafness does not lead us down a slippery slope to designer babies. It instead supports deafness as a valid culture which follows the identity-based model, empowering the deaf community which faces eradication by the same means that could save it. Deaf parents will better facilitate their child's education if they attend a deaf school because they will not face disability barriers as they would at a hearing school. In the article A World of Their Own, the deaf parent Sharon recalls her education at the University of Virginia as an isolated, numbing experience. She would struggle with the language barrier, which required each lecture to be transcribed into long 30 or 40-page documents. This same language barrier would prevent a parent from helping their child complete homework, but more importantly, it would impede their communication with their child's educational professionals. If their child struggled in classes, the parent would have little opportunity to discuss these problems and help their child improve. It would also impede the child's sociability, as most deaf children are separated from their hearing children in the public school system. Even in cases where they are not separated, deaf children are frequently othered by their disability because they cannot communicate effectively with their classmates. By selecting for deaf characteristics, deaf parents are protecting their children by their inclusion into a wider deaf community. By allowing deaf parents to select for fetal characteristics of deafness, we are empowering the deaf community with their identity-based model of disability. The deaf have built a community and culture united by language and art. ASL unites the American deaf community, while Auslan unites the Australian deaf community. In the Vice article, Why Some Parents Choose to Have a Deaf Baby, the author describes how hearing people who attend a deaf stand-up show felt like a tourist. And like any good stand-up show, tourists become the butt of the joke. Deaf comedy is made specifically for deaf people, showcasing how humor is a cultural practice. In the same article, the author describes a deaf rave party and deaf theater, each calibrated to suit deaf senses. By validating deaf culture, we are accepting the deaf community socially. This rejects the medical model of disability, which views disabilities as solvable problems and focuses on normality as the ideal human type. The slippery slope is a fallacy and should not constitute an argument which governs important topics such as abortion and genetic choice. Often the slippery slope argument is employed as a last resort of traditionalists who lack a better argument. This is an example of the prudential slippery slope. Policy A will lead to policy B. Policy B is bad or undesirable, therefore we should not accept policy A. There are many reasons to reject the prudential slippery slope, most notably because it relies on fear rather than affirmation. If all policies were debated on the premises of the prudential slippery slope fallacy, there would be no social change. For instance, the abolition of slavery was desirable to abolitionists, policy A, but some abolitionists thought it may lead to interracial cohabitation, which they thought was undesirable, policy B. Despite their distaste for policy B, they still adopted policy A. Many social changes have followed this formula, such as women's suffrage, which some assumed would lead to women's rejection of motherhood, same-sex marriage, which some believed would eventually encourage pedophilia or bestiality, and abortion, which some believed would lead to a breakdown of gender roles. Rather than reject policy A because it may lead to policy B, we should instead legislate how policy B should be regulated, and in this case, policy B is designer babies. Genetic choice for deaf parents is key to deaf community survival, as genetic choice encourages parents to abort fetuses which show signs of disability. Genetic choice allows parents to select for fetal characteristics which will align with their child, whatever they consider most normal. The UK's Human Fertilization and Embryology Bill disallows parents to select characteristics which denote serious mental or physical disabilities or illness without quantifying what serious actually means. The vague language of this clause means that any parent who wishes their child to match their disability culture, such as deaf, may not be allowed to, which could lead to an eradication of deaf culture and deaf society. Any hearing parent who wishes to use genetic choice cannot choose a deaf child. Obstetricians, who pregnant women come in contact with most, rather than geneticists or genetic nurses, have been found to be the most directive in their advice for pregnancies. The majority favor termination of fetuses with open spina bifida, Huntington's disease, Down syndrome, and muscular dystrophy, and a substantial minority favor termination of fetuses with cystic fibrosis, sickle cell, achondroplasia, PKU, and hemophilia. This reveals a eugenic attitude towards obstetricians' advice for their patients. Most pregnancies terminated for disabilities which are non-lethal and unlikely to cause pain, such as death or autism, are terminated on the basis of social factors rather than medical factors. They are terminated because the parents fear how the child will grow and thrive in a society which devalues their experience. While valid in their concerns, social issues such as discrimination cannot be ended by terminating disabled pregnancies, but by changing social factors which could cause discrimination. The study concludes that development disorders and intellectual disorders previously misunderstood as having no cause may be identified as prenatal genomic sequence testing. The study also concludes that it has found a cheaper method for this testing and hopes that genomic sequence testing could become routine as its costs go down, making it widely available. With this conclusion, they can see how genetic choice could eradicate many disabilities beyond life-threatening ones, which could include cerebral palsy, Down syndrome, Fragile X syndrome, and the deaf community. As genomic sequencing testing grows more common, the eugenic behavior exhibited by prenatal doctors and legislation which disallows for disability choice, the deaf community and other disabled communities face eradication through genetic eugenics.